Here we go. Well, good morning, everybody, and welcome back to Bartow's Morning News. Alan Sanders here in studios. And as promised, joining me now, we've got Dr. Melissa Green, a licensed clinical psychologist. Good morning. Melissa, I'm sorry. I've been saying Michelle for some reason. I saw Melissa, but Dr. Melissa Green, you can get a little closer there. How are you?
I'm fine, thank you.
Good to have you here in studios. You've actually been all over the country, including the Virgin Islands, in your career.
I have. Kind of been all over the world, actually. Yes.
Well, tell us a little bit about what got you interested in the field of psychology to begin with.
Actually, a 7th grade science project, a science fair project got me interested. I did a project on reaction time where I tested people's quickness in catching a ruler, and I looked at the differences between the times and what might have interfered with somebody being faster versus slower. And that's how I started getting interested in human behavior and what motivated it.
Interesting. So all the way back in middle school.
Yes.
So you went all through to college, decided to major in psychology.
I did.
And then from there you decided that this was a field you wanted to go into. So needless to say, with psychology, you can't just start practicing with a bachelor's.
Correct. So initially my goal was to get a doctorate in clinical psychology, get licensed, have my own business and all of that. But I had an advisor when I was in undergrad who introduced me to the field of school psychology, which is psychological testing in the school setting. And that's one area of psychology where you can call yourself a psychologist without a doctorate, but you can have a master's or the specialist degree, which is between the master's and doctorate. And there's a really big demand for that field. So he introduced me to that, and he said, you can do that while you're working on your doctorate. So
excellent. So you had a chance to be actually helping kids and testing kids and doing some of the work that was going to be part of your field anyway.
Yes. Yeah.
Now, where did that take you? How many different states were you doing that?
So I went to school in Washington, D.C., Howard University and George Washington University. So I started my career in psychology there. So I worked in the public schools in Washington, D.C. I also worked in the schools in Alexandria, Virginia. Then I went back to school to get my doctorate, and I moved to Georgia to do an internship, which is Cartersville is my hometown. I grew up here.
Really?
Yeah, I was born here, grew up here, graduated from Cartersville High School, yes.
So, well, that was a nice little nugget of information.
Yes.
Excellent.
So then I came back home to do my internship, and before you can practice as a psychologist, even after you get your doctorate, you have to get licensed for a year by, you have to get supervised for a year by a licensed psychologist. So I was still doing my school psychology work in Clayton County schools here. So I did that for about 3 years. And then I moved to Hawaii after I got licensed.
That must have been a tough stint.
It was so hard to leave Georgia to go to Hawaii, yes. Yeah.
Now, you spent a few years there in Hawaii.
I was in Hawaii for 7 years, yes. And so the first year I was in education, but working as a clinical psychologist. So they have both school psychologists that do the testing for special education services, and they have clinical psychologists that supervise their therapists that meet with the children one-on-one. So I did that for a year, and then I started working with Marines doing combat trauma therapy. So that's what brought me to my current specialty, which is trauma, particularly combat trauma. So I worked with them for about 6 years.
Wow. So now, what did you just get tired of Hawaii, or somebody called you back to be closer to home, your roots, what?
Yeah, my dad actually. My dad, he has Alzheimer's and vascular dementia, and so I came back to be closer to help to care for him, and that actually has taught me a lot and made me start really researching how I can help other caregivers. So that's another part of my practice that I want to develop, to reach out to people who are caring for elderly parents, particularly with dementia.
So I know you said that you started working with PTSD patients, folks who had been in combat or had seen trauma of some kind, but I noticed in your some of the bullet points about what you do that you do want to also help families that can, because it's stressful dealing with somebody who has an illness like Alzheimer's,
Right.
especially if you're the caregiver.
Exactly, and a lot of times the caregivers will neglect themselves because the focus is on the person with the illness. So it's very important to take care of yourself so that you can be able to take care of someone else.
I'm so glad you brought that up. I know we've had several people in studios over the course of the years that I've been here that have ways of either being like the interim that says, because you need that break from time to time, because if you fall apart, then what's going to happen? You know,
Correct.
you've got to take care of yourself. But then so many people say they suffer guilt if they want a day off, if they want to just go and do something for themselves. And that's okay. Go do it. You need to recharge.
Right. Because if you don't, you may feel guilty on the other end because you may have short patience with the person and may say things or do things that you don't mean to do just because you're tired and exhausted. So it's important not just for you, but for the person that you're caring for.
We're here in studios. We've got Dr. Melissa Green with us. We're going to talk when we come back about coming back to Cartersville and setting up a location of her own, and there's going to be an open house coming up in early February. We'll cover that and more when we come back for more about the All About the Business segment.